What types of cervical cancer are caused by HPV? Imagine a virus that can quietly cause changes in the cells of the cervix over many years. Human papillomavirus, or HPV, is just that virus. It is responsible for nearly all cases of cervical cancer, especially when the infection persists over time. The two main types of cervical cancer linked to HPV are squamous cell carcinoma and adenocarcinoma. Cervical cancer begins in the cells lining the cervix, which has two main types: squamous cells on the outer surface and glandular cells lining the cervical canal. Most cervical cancers start at the junction where these two cell types meet. When high-risk HPV infects these cells, it can cause abnormal changes that may develop into cancer if not caught early. Squamous cell carcinoma is the most common form, making up about 70 to 90% of cervical cancers. It develops from the squamous cells on the outer part of the cervix. High-risk HPV types, especially HPV-16, are strongly associated with this type. It often takes many years for these abnormal cells to turn into invasive cancer, which is why regular screening is so important. Adenocarcinoma accounts for roughly 10 to 20% of cervical cancers. It originates from the glandular cells that line the cervical canal. HPV types 16 and 18 are the main culprits here, with HPV-18 being more closely linked to adenocarcinoma. This type can sometimes be harder to detect with traditional Pap tests because it develops higher up in the cervical canal. Other less common types include adenosquamous carcinoma, which has features of both squamous and glandular cells. These are also associated with high-risk HPV infections. The high-risk HPV types responsible for cervical cancer include HPV-16, 18, 31, 33, 35, 39, 45, 51, 52, 56, 58, 59, 66, and 60. Among these, HPV-16 and 18 cause about 70% of invasive cervical cancers worldwide. The process begins when high-risk HPV infects the cervical cells and causes changes in their DNA. If the infection persists over many years, these changes can lead to precancerous lesions. Without treatment, these lesions can progress to invasive cancer, usually over a span of 15 to 20 years. This is why regular screening and vaccination are so important. In summary, HPV causes cervical cancer mainly by infecting the squamous and glandular cells of the cervix. This leads to two main types: squamous cell carcinoma and adenocarcinoma, with HPV types 16 and 18 being the most significant contributors. Understanding this helps emphasize the importance of HPV vaccination and routine cervical screening to catch any abnormal changes early. Always consult healthcare professionals for personalized advice and screening options to stay protected.